I'm going to call the insurance committee meeting to order and turn it over to Michael to
Thank
go
you,
over
sir.
premium equivalents.
Thank you. And welcome everyone, and thank you very much again this year for being here. We've distributed 2 pieces of paper out to everyone. Number 1 is the first issue that we would like to discuss as the exhibits are in reference to potential premium equivalents for Columbia County for 2026. As always, our Labor Council, Elena DeVeo-Keen, is here to speak with us in reference to the grander scheme of things when it comes to how this affects the county and currently with our negotiations process.
Okay. So what you're looking at here is all the hard work. Thank you very much from Lori and Michael and their office. And they're giving you 3 potential options. And just to answer the first question that you have where it says 10 and 15, and you see 15 and 15 and 20. The first number represents what it would look like based on the increase in the medical piece. And the second number represents what would the increase on the prescription. So I just want to remind, before we get into this and everybody gets a little sticker shock, I want to make you aware of a couple critical pieces in all of this. One is this year, the anticipated increases at the federal level for health insurance is anticipated at 18%, and CDPHP on their commercial plans locally is at 20%. Though I looked at Michael and I go, I question that number. I think it's higher, but whatever.
So we were told.
So that's the first piece of it. The other piece of this is, remember, these are not insurance premiums. You are establishing the premium equivalents as an ASO. So as an ASO, we are responsible for not only costs, but every single claim that's paid. So when you look at this kind of walks you through some of these numbers. But before if you flip onto the back here, it'll show you the health claims over the last several years, the RX claims, the administrative cost claims, which has remained steady. That basically is just adjusted based on the number of employees, very candidly. And then the stop loss. So a couple things to look at. I want to highlight the first thing when everybody goes, well, wait a minute, why do we need to increase? Health claims are down $1 million. And I want to just stop and say a couple of things about this that's really important, which is this reduction this year is a result of claims that result of either 1 or 2 people. So that just shows you the increase. So you could have that again or not, but these numbers are out there. The second critical piece is that you'll look down below, and this shows you what we have in reserves. In 2022, the county had $800,000 in reserves. Right now we have $200, okay? As a result of the fact that the county only has $200 in reserves, which is woefully lacking, in the year 2024, the county had to advance $2 million from the general fund to bridge the delta between what was collected and budgeted and what we actually needed in claims and costs. In 2025 year to date, and we're only in the middle of October, we have already advanced approximately, and I'm just doing approximately, $500,000. So while, yes, it looks great that the claims are down on the health side, you'll notice there's increases on the other side. One of which is we're up $500,000 in RX claims. Our administrative costs, like I said, are relatively flat, but we're up $75,000 approximately in our stop loss, and we have $200 in the reserves. So the 3 options that we have available to flip it back over provide some increases. And I'm going to let Michael talk a little bit about what those look like, but I just want to remind you historically, since we instituted this in 2014, of those years, we've had 3 years where there were no increases. We've had 1, 2, 3, 4 years, 4 years in which the increase was 5%. We have traditionally been substantially lower than your commercial plans have been out there. But, no one likes to see double digits, but that is unfortunately the trend that we have seen in the last couple of years at 15%. So with that said, I'm just gonna kind of turn it over to Michael and let her walk you through what these numbers actually look like, and you can answer your financial questions.
So we tried to give you, from the perspective of the increases that Elena had discussed earlier on both the CDPHP level as well as the federal and state levels. Attached, you'll see three separate scenarios. In the box with the 10 and 15 or 15 flat or 15 and 20 represents the health insurance percentage increase. And then what would be a percentage on the prescription end of it. With respect to the fact that, as Elena pointed out, the prescription amounts were certainly much higher this year. We were very fortunate to have some of the medical bills go down. But as Lori had pointed out to me earlier, we just literally walking down the stairs, we received an email for another high cost notification for another prescription drug. So these can come in, I mean, by the minute. It's just constantly ever changing and increasing. So to give you an understanding, what this has done is this is based on taking then the premium equivalents. As Elena mentioned, we do not pay premiums. We do, or co-pays, excuse me, I mean, whatever they call them at the level, excuse me, H&O level. Commercially, for our ASO plan, we have our premium equivalents. So showing you the number of inhabitants, belly buttons, as well as, this is not our census, this is the number of people enrolled, our number of plans enrolled, excuse me. So therefore, we go through and see what the amount estimated to annual expenses. And then in addition to that, Lori went as far with the detail to break out to show you what, with this based, all of these individual and family percentages are what are currently negotiated with our labor unions and management being subject to the UPSCU contract, would show you what those plans would be. Flat means that the person just pays a flat percentage was negotiated, versus if you see where it says 15% family or 25% family, that's a percentage for that type of family after the individual plan is deducted from the cost of the plan. And then it gives you in 2025 what per paycheck the employees were paying or are paying currently, excuse me, as this is 2025, don't get ahead of ourselves. With 2026 showing percentage-wise what that would go up. The DIF PP is difference in paycheck. So each pay period, each paycheck, the person's paycheck would be influenced additionally in that amount, and difference per month would be the amount. It would go up additionally on top of what they're paying. And again, this includes health insurance and prescription.
So I just have one very general question.
Sure.
This census is the number of plans enrolled.
Yes.
How many people buy out?
Buyouts are on the back.
Yeah.
And our buyouts this year are in line for 53 individuals and 73 families.
Okay. So that's 126.
Mhm.
Okay, thank you.
You're welcome. Good question.
And that's for all the unions, not just one union.
Right.
For all the employees.
Right, depending on where people fall as to what category, because you may have individuals that were hired prior to June 13th of 2018 that may be subject to a different percentage under our UPSU contract, or even some of our other contracts, in accordance to where other individuals may fall. So does anyone have any questions about this? I know you guys have been doing this for quite a few years, so.
Can you just put the right column, 5% individual, I understand what that is. So the 20% flat, explain that again.
So that's a person after, I believe it was, June 13th of 2018. With our
Right.
just only PSU, right? So it was anyone coming in that was a brand new employee, flat 20%. So there may be other individuals who were 5% because they were hired prior to that date.
So all of these are what we have presently.
Exactly.
In
Yep,
certain
absolutely.
categories based on time.
Exactly. Yep, depending on which union
When they
and
came in,
and
what
when you were
union.
hired.
Okay.
Yep, they would qualify.
I think we actually got 20% across the board in all our other unions too.
As far as new ones are coming.
New
Yeah.
employees, yes.
Exactly.
Everybody in that year during the contract negotiation agreed to 20% across the board coming.
Yeah, that'll be something kind of interesting going forward. Maybe next year we could do a comparison to see, because you are, like you say, as you have people either leaving or retiring, new employees will be subject to 20%.
And then on this chart, you have 10 and 15 on the top. 10 is the medical, 15 is prescription, but 15 represents what? Medical in the
15%
middle?
flat,
Both.
15,
Both.
Yep,
And then 15 medical and
and
20.
20%, right.
Okay, thank you.
So because my brain is a little fuzzy today, we were in the same position in terms of the reserve last year.
Mhm.
What did we do last year?
So last year was a 15% flat.
Okay, so that's our context. So we know 15% flat's probably not gonna do it. I'll just throw that on the table. Somebody has to
And
start
to
the
give, and to give
conversation.
you some, and just to give you a little bit of historical history on ProAct, we had in 2015, it was 2%, 2016, it was 5%, 2017 was 6%, 6.5, just so you know, in the middle of COVID, we flattened out in 2020, and we did not increase that period of time. And then we went in a very small increment thereafter.
So the 2025 year to date, we're 500K from the general fund. Is that for what period? Is that through August or September? Is it,
That's year to date,
that's year, so it's through
so
October?
up to today.
Okay, so through September, so that's 75% of the year. Do we know where we'll be I mean, if we're at 500 now, do we think we'll
We need
be?
that crystal ball. We have no idea.
Okay,
Yeah, we extrapolated and estimated through the end of the year based on what we had. So we carry directly through
okay, so
December 31st.
I'm playing catch up. I'm just
No,
thinking.
it's like, it's like based on the same averages as that we had, but certainly
So lower
understanding,
than last year.
but certainly understanding and respecting that if we had one horrible claim between now and December 31st, that could vastly change how that is.
Okay,
And I think those are all really great questions you're asking, because these numbers don't mean anything without appropriate context. So
Right.
those are really important questions, which is one of the reasons why, the first thing I said was, people are gonna ask, why is it down 1 million? And they're like, it's one person. This year it's one person, the year before it was one person. It doesn't matter who that person is, but if you have one person with a catastrophic injury, which could even happen in, December 15th, it could completely blow up the proverbial apple cart.
so I'm going to ask another question, which is, in terms of retiree plans, are those incorporated in this census or not?
Yes,
Okay,
as far as the number of people involved.
enrolled,
Yes.
okay.
But those are only those individuals enrolled in the ASO, not retirees that have then since moved to
They're only
Medicare
individuals.
and
Right.
Advantage plan.
Which we were making sure that people were doing that, correct? Is that what
To the
we talked
extent,
about at the last meeting as
We'll
much as
be
we could.
right, we'll be
Okay.
working towards that, but, she's just asking in reference to these numbers,
Right,
whether
right.
it's reflecting what we consider, what we call our commercial plan as our ASO.
But based on this, the 15% flat, as Brenda said, doesn't really cut it. So the first scenario is really not even an option.
Well, you're comparing the 15% as what happened last year. The 15% is looking at potentially a 16.3 as far as expenditures are concerned, in comparison to the 15 that we had this year. So I feel that would offer, if this was potentially exactly where it needed to be, if you're talking true apples to apples, which we have absolutely no way of estimating whether that's the case or not, then you could replenish the reserve.
On the
costs-
first
so
scenario?
what factor, what would the reserve replenishment be?
Well, you would have a difference of,
800,000.
right,
I was gonna say, yeah.
Right.
800,000.
Of course, we sat
Where
here,
we used to like to have 2 million in that account.
no, and I understand where you're coming from.
and we sat here last year and came up with a 15% increase, and that was gonna replenish the reserves by 500,000. Didn't
And it
happen.
did, that's why I threw that
Right.
tidbit out on the table.
Right.
And we know the cost is gonna go up over the next year. We always seem to be chasing our tail. We're more current than we used to be, there's no question about it, but we're still behind, okay?
But the other thing and maybe this is not a factor, but if certain Medicare Advantages plans go away, is it gonna be harder to push people off onto those plans?
No, we have one Medicare Advantage plan that the county deals with, so
Okay.
that would be, yeah.
And
that
we
would
know
be-
if that one is it'd be okay.
And if it wasn't, then we would shop for, certainly we would beg to get on that. That she would shop for
No, I
something
just
else.
saw
Yeah,
headline in the paper
no, that's a
today
great
about
question.
The Medicare Advantage plans being discontinued by MVP.
Oh, okay.
So I'm wondering if we're solid.
Some are leaving different counties, but right now you guys are looking at them, that's fine.
Okay.
Thank you.
So based off of this year's numbers, 15 million, if we did 15%, we're saying we'd collect 16.4, correct, 1.4 million.
If
If you
everything
knock
stayed
out
the
a
same.
$500,000 of what we anticipated last year and we didn't get, we're up to about 800,000, correct?
Something has to be done because you can't continue to draw on the reserve. You
Right.
cannot on your.
General
on the
fund.
general
That's
fund.
my
I wanted to
point.
call it the reserves and he was gonna give me the death code, the wrong word.
No, I'm just, I'm agreeing, but 800,000, you know darn well, the cost of insurance for 26 and the cost of claims is gonna go up.
No, I'm agreeing.
That's what they're saying.
So,
Yeah. Especially
I'm
when
saying that
amount
I
is
think
swallowed by
it's-
1 to 2 people.
They're responsible to think we could do the first one. That's
No,
my opinion.
I think we were just looking to give choices, so you had to.
Oh, no, I get that, but I'm just giving my opinion.
Which is
Three
one of-
choices, yeah.
Which is one of the reasons why we're in the middle of negotiations with unions about some what we call non-impact, hopefully less than painful changes that could make some savings, but we don't know. We're not done yet.
But we also know, well,
But those are some of the things that we need to look at. Even at 15% across the board, you'd still be less than,
The reserve amount.
well, no, you would still be less than what CDPHP and their commercial plan is charging.
right, and if you look at the next plan, it's not that much difference. If we look at the difference number, it's not that much, it really is not. It's not significant, but 1 to 2 is,
So what are we thinking here?
Here's the one thing I would say to you is you should look at what the difference in per paycheck is for these individuals that are gonna have to pay these amounts.
Yeah,
You know, it's easy to say, okay, let's do this, but it's also on the backs of some of your employees. So I think that's the only thing I would encourage you to just look at those numbers and see where you are.
I mean, honestly, again, between the middle one and the next one, the difference is not that much. Sorry, I don't want to count people's money, but 90 cents and, I think the bigger jump obviously is from the first set, then when the last is not that much. And are these the only 3 options we have, or we could say 17% flat? I'm just throwing that out there.
This is just a reference.
Right.
Right.
Yeah, I mean, what we tried to do is we tried to go through and look at the percentages in comparison to what was being offered on the federal and state as well as
Sure.
our brokerage level, not our brokerage, excuse me, our companies.
I mean, my town is 20%, we're doing that right now.
And initially they presented more options, but they weren't gonna get us where we needed. They weren't even close to the 58. So.
We're being falsely optimistic.
We don't have any percentage of, I know we've talked about this, but I'm sorry, I don't remember the percentage of those higher claims, the ones that kind of wipe us out.
Mhm.
Are there on average 4 or 5 of those a year or 20 a year or?
No, single digits, 1 or
Right.
2.
Right, our
stop loss claims,
anything over
Right.
$300,000.
Right, oh, so they're single digits.
Right,
Okay.
3, 2, 5, 4.
So we're 5 this year and we,
But technically,
got
those claims were from
another.
2024. That's a high cost modification. Yeah.
Well, I
so
think,
it's a very, it's
yeah.
less than 1%.
you have to.
Yeah.
It's a very small percentage.
But that's all it takes subs. You know what I mean?
Right.
It's not the
No, I know.
little ones that are really.
Right.
I mean, I would be inclined to do the 15 flat.
And as I
as you said, we have no crystal ball. The best case scenario, we're still not where we need to be. Worst case scenario, this number is irrelevant, so.
Well, and hopefully some of the work that HR has been doing.
Yeah.
And Elena with the union, hopefully some of that will pay off.
Some of the other changes too, I think we did earlier on in some of these other meetings.
Are being worked on.
Well,
Yeah.
and I do think our employees are counting their pennies. So even though there's not a lot of difference between 2 and 3, I think it will make a difference to them.
So does anybody, before we vote on this, anybody have anything to add? Rob, do you have anything you wanna?
Everything seems fairly clear.
Okay. Thank you. All right, so entertain a motion to adopt the option of the 15% increase both for medical and for some pharmaceuticals.
I'll make that motion.
Motion Rob Livonia,
I'll second it.
second, discussion. All in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. Thank you for such a clear picture.
There was one other thing that we have to go deal with is the New York State mandates, with the second piece of paper that you received. Lori and Michael put this together for you, and these are, as you know, because you're an ASO, you do not have to include mandates, but these are the new mandates. Please note that CDPHP will automatically apply them unless you formally opt out, which is a little bit different than the way we used to do it. So the first one actually requires no action because you already had it covered, which is, covering prescription drugs, for epinephrine and auto injectors. You don't need to do any action on that. Number 2, it was recently signed by the governor, retroactive back to January 1st, 2025, just so you know. So don't think that you guys didn't look at it or CDPHP, drop. It just got retro back, but just know there have been no visits year to date. So if you want to opt out of this, you have to make a formal motion and do that, and then notify CDPHP. And then the third one goes into effect January 1st, 2026, unless you opt out, which is requiring that you cover scalp cooling systems for chemotherapy. It's basically to assist in the loss of hair growth and other trauma that the head experiences from chemotherapy. And Lori gave you some estimates of what those costs are. So those are 2 things that you do actually have to take an action on. And then I would refer to Michael and Lori, who will be able to give you much better information.
I mean, truly, all information is on here. We included everything that we had, and certainly CDPHP returned information on top of Lori's research. As Elena mentioned, we already have the epinephrine auto injectors. Were already included in our policy, so that is not a problem through either CDPHP Tier 2 or they get them through CanRx at a 0 copay. So there's no action that needs to be taken on number 1 by our committee. Number 2 is in reference to the neuropsychological exams for dyslexia. After they receive the actual appropriate physician's referral. This is going into effect retroactive to all CDPHP plans starting January 1st of this year, okay? But as an ASO, we have the ability to elect not to cover these. There have been no visits in 2025, so that's why there's been no discussion about whether or not it would be included. But it states here that exams, it was sent at $150 to $230 a visit. So you would need to vote whether or not this is something that automatically goes into the plan, and then we have to opt out whether we are not going to elect for this to be in our plan.
So what is a neuropsychological exam? Is that a confirmation of the diagnosis, basically?
I would assume so.
Does that mean there's no copay for that when they say it's mandated, or is there still a copay by the patient?
No, they'll still pay a copay, yeah, but it'll be at the minimum 25 that was traditionally in there.
Dyslexia is so costly if it's not diagnosed early. That's why I would suggest that we consider this, particularly if there've been no demands.
There have been none.
It's just such a costly misdiagnosis or lost opportunity.
And a lot of times, you know, just like your high cost claims or any type of notification, there's absolutely no way for us to know. When we have historical information, we can supply to you. We've seen an increase in, you know, from 4 to 6, or this is clearly something that we have not dealt with through our ASO at all.
We're not dealing with it because they don't know about it or they don't have the coverage for it. Or,
Right, potentially.
There's no way
So my
for us
point is-
to know that.
correct, but my
Because-
point is if people knew that it was a covered, if it was covered, would then there be more?
So again, I don't know how we would
Right.
be able to prove that,
Sure.
because I would assume that a doctor, if there was a test, an
Would
exam,
say,
or
"Go get
something
it,"
that
and
had to
then-
be
Yeah,
done,
right. And it would be
just-
denied.
right, exactly,
Yeah,
and then we
right.
would be dealing with the denial process,
Right.
which traditionally always comes through our office and
And
Lori
we've had
deals
none
with.
of those.
None of those. So that's a great question,
I mean, who
but,
knew it wasn't covered? You know, like,
right, and I'm going to say, anytime there is any type of medical function or any medical testing, even if it's not covered, there is a conversation that happens between our office and CDPHP. And if it's not with us directly with CDPHP, it's certainly Meg and Marshall and Sterling's conversations that are happening with the physicians and or the insurance company. So, sorry, why don't you, Meg?
I don't see a lot of these questions come from the dyslexia piece right now.
Thank
so
you.
It's probably maybe up and coming, maybe because too, there is more and more, I think, coming up with kids in school, things that are, they're identifying it.
Recognition.
So maybe we'll see it going forward, but I don't hear of a lot of denials on this right now. I don't know, from all my groups.
So if we want to move forward with this, we need a motion to,
I think if we want to move forward, we just leave it. right?
If you
Oh,
want to
okay.
keep it, we just notify CDPHP, it's fine. If you would like to have it removed, then we would, I'm assuming we would do.
Can we
a
talk through
motion.
the third one before we make that?
Sure,
decision?
absolutely, of course. So the third one, again, is a mandate that as far as large group insurance policies are required to have effective the first of the coming year. This is something that, again, as an ASO, we are able to choose whether or not we want to elect to cover. Cooling systems can cost approximately $1,800 per device. And Elena spoke to what the purpose of this device is and what exactly it does.
When you say per device, is that basically per device per individual?
Yes.
Okay.
So it's
Now,
not,
like an
it's
individual
not
needs
It's a
more
general
than
benefit.
one.
correct,
Yeah.
but it's my
It's a piece of DNA.
understanding that it can be very successful, but it's also my understanding it's incredibly painful. So I don't know how many people are actually going to do it.
Yeah.
Is it for all kinds of cancer or just one kind of cancer? It says for cancer, for chemo, for.
Cancer, well, your hair comes out as a result of chemotherapy, so the cooling cap is designed to assist in preventing the loss of hair. As I understand it, I am not a medical professional, but as I understand it, from actual personal experience with some people that I know, it's designed to help you keep your hair as well as any damage to the hair follicles moving forward.
So not necessarily designated for a type of cancer. It
I
would be
understand.
cancer as a.
And how
Treat
many,
umbrella.
how many cancer, do we know how many cancer a year?
I would, my opinion is I would say yes to 2 and no to 3. But I'm willing to hear others.
I feel the same way, and I may be prejudiced because I'm a cancer survivor, so I've gone through chemo, so the loss of your hair is minimal compared to everything else.
so in this particular case, we would have to vote to opt out.
Yes.
So
I'll make the motion on number 3 to opt out.
I'll second it.
second, discussion? All in favor?
Aye.
Opposed? Carried.
All right, the other two are just informational things, that's why we have no materials on it. Earlier this year, we had come through this, committee in order to, grant approval for us to go out for RFP for our ASO services as well as our prescription benefits, and we also discussed our section 125 flexible spending benefits. So, we had come back and said, listen, with those two really important RFP processes that were going on, we didn't want to rush to do health equity for the section 125. So we opted to just extend the contract through next year. And we have been notified with all the changes with CDPHP. CDPHP is going to be severing their ties with health equity, who is our current cafeteria 125 provider, and they're going with a new company. Well, it's not new, but they're going with their global company of LBS, correct? Yes. I don't think there's an M there.
Benefit solution.
Thank you. Okay, so as a result, LBS will be coming on with all CDPHP carriers. I got the semantics of the ancillary agreement with them. But we just want to make sure that everyone understands that we will not be going out to RFP this year. We will be going out to RFP next year. After discussions with the county attorney's office, it kind of feels that it's the best thing to just stay with CDPHP because then our claims will be still tied into our ASO provider. And then next year we can take a look at going back out for RFP with our Section 125 carrier. Okay.
Is there any way that we can provide some notice to the members? I mean, Rob is here. Thank you very much for being here. But, you know, it's these types of things that go out that then people think that we're keeping information from them. And
We
I
will
think
once we have anything.
Yeah.
We actually started with nothing.
No, but I like once
No,
we do,
no, and I appreciate that, thank you. No, we started typing a letter saying, and we found like, okay, it's gonna happen. Okay, we don't know that. And they're gonna come for, and we don't know that. And then, and we just kind of kept typing and there were all these big holes in there. So the letter that did come from CDPHP notifying us of their change did say that we'll be able to sit with the new company to be able to go through what the enrollment process would be. And Lori certainly ties any changes into how that affects open enrollment for the county and within our office. And then we'll get that notification out to employees. And traditionally, anything we send out to employees always gets CC to our union. So we'll make sure they know as soon as we can.
Just really high level, do they have to re-enroll or are they just that enrollment carryover?
They have to re-enroll every year. Yeah.
So they're not only will they have to re-enroll, but they'll have to be an enrollment period.
Right, which we always have every year
Right.
anyways, in
Okay.
traditionally the end of November, beginning of December. And flexible spending is a contract that you're only signing for the year.
Right.
So even if you don't want to elect but enrolled before, you still have to go through that process.
I think
So-
that's, we just got something about that.
Oh, good.
Yeah, so I
Yeah.
think that's going out, but you won't know what, if anything else will change until you get a letter from them. So
Exactly.
you'll detail all the changes in one letter.
New company always means new website, new
Right.
card. So that's the minimal that'll be taken care of. Meg was just discussing with Lori and I prior to this, as far as what that's going to mean for an admin agreement, for the county to sign on to be with this. We would do a 1-year agreement because that would tie in with our RFP process to go forward for next year. And hopefully if this company works as well as Health Equity always did for us, then we'll form a great relationship with them as well. And they'll be able to come in and hopefully apply for the RFP for going forward. So I think that'll be great.
People who have balances at the end of the year, still have to deal with the health equity, or will that convert over to a new?
Everything would convert over to a new company. Yeah. And certainly Health Equity reached out to us and asked if we would consider staying with them versus going with the new company. And I did talk to, Rob Fitzsimmons in our county attorney's office about that. The issue is that once there's that severance of relationship or the tie in between our ASO claims and the 125 carrier, it's not going to offer that direct connection that we've been able to have with Health Equity so far. So it'll be fun.
And when was the last change?
We went to Health Equity in 2020, 21.
Okay, so I'm just going back to the
21,
latest point.
yes,
Change
2021.
is difficult for people and the
Yeah,
fewer changes, the better.
right. Which is why we figured we were going to try not to switch because we were going to be going out to
Out to-
RFP next
Right.
time. But then it was brought to our attention that if we were to stay with Health Equity, okay, yes, they would see the same card and yes, they would see the same website, but the information is not integrated. So they wouldn't have the same accessibility that we've kind of been spoiled with over the last year. So.
We got new cards. Isn't that card branded with like a CDPHP logo?
It does. And if we stayed with Health Equity, they would have to issue new cards anyways because they wouldn't have that affiliation with CDPHP.
So you're always gonna have a shiny new card.
Most people lose them
Hard to
and
keep
Lori
track
thinks about a daily
Right.
basis anyways, so I'm sure that's not a problem. So, and the last piece was in reference to, I apologize, but we have no further information on, we're waiting for information from CDPHP, on a program called RX Concierge. Did anyone share any information, Ms. Marshall and Sterling, in reference to this?
No, the only piece that I can kind of speak to is for your population, there was really no cost to the membership or you yourselves, except what will happen is employees, providers will go out to CDPH will reach out to a provider and say, would you consider using this drug as opposed to this drug that you may prescribe? They would directly speak to that provider, and then that provider would then possibly make that switch. That switch would then save you as the administrator money, and then possibly the employee, depending on tiers and depending on which drug tier it falls into.
Okay.
So
There is a return on investment on that piece, so there's a guaranteed savings the first year. So whatever you actually are potentially gonna have to pay out per month, you would get that back year one, because they're guaranteeing that you will have additional savings more than what you're gonna pay out in the administration.
But that's retroactive, right? Because
Well, that's what I was gonna ask. My only question that I had was in reference to, is this a decision that would have to be made to integrate January 1st? Or is this something that the committee we can wait until we get more information and to be able to present it to them so they have?
You don't have to roll it out January 1st, so you have the option to roll it out. You can even roll it out mid-year, because there's really no difference to the employee. It's just gonna be a matter of the carrier then reaching out to the provider.
Thank you.
Can I ask the question? Just, I'm thinking from negotiation purposes. Is the employee opting into this?
The employee really, yes, because the employee, there's really, the employee doesn't have to do it. It's not anything it's not mandated. So if the provider goes through this and then they say, okay, you want to switch to this particular medication, if the employee says, I don't want to do this, they do not have to take that medication. They're just trying to proactively see if there's alternatives for them to take that potentially could be, less expensive.
so when does that happen at the time the medication is prescribed? Or once the prescription has been identified, i.e. filled, and then CDPHP, the concierge services reaches out and says, for your refill, would you like to change?
Could happen both ways, but they're
Okay.
never gonna really go directly to the employee.
It's always the
They're always
provider.
gonna go to the provider, then the provider is gonna have that
But
conversation.
typically you walk out of the office with your script, or you go to the drugstore for your.
Before you change.
Right.
So they'll take they'll look now currently what people are currently enrolled in, start those conversations with
Early.
providers early to see
Okay.
if they can potentially get them to switch today. Then if something else comes up and then someone gets prescribed something like going forward, then they'll try to have those conversations.
In
to see-
advance.
In advance.
Okay,
So they're gonna try to do both. They'll try
that
to.
seems harder to manage.
Yeah. Well, I thank you, Meg, for your input, seriously, because, I appreciate the fact if it's not something that has to be done on January 1st, then we will work with, our CDPHP rep, to get the information that we would need to prepare to present to you, to look at anticipated savings and potentially whether or not this could be something that we could implement at a later time. Lori and I have been working diligently as well on we'd like to present to you a retired employee health insurance policy. Has gotten to the point where we would like to come and put something more formalized in place so people understand, as far as the payment mechanisms, ensuring that they have in writing about our ACH process, but also unfortunately about bouncing checks. ACH is coming back and not having the money in there, and what exactly that means, as far as, exactly. Health insurance companies want their money on the first of the month for that month, not 60 days later to go back and post a payment back. So we'd like to bring something that we've been working together on, but it's just too much to kind of present all in one meeting for you guys, especially with premium equivalents. So we'd look at something like that for the first of the year.
So in
Okay.
terms of this concierge service, as it's been presented, is there any way to forecast what, just in very big round numbers, what that might be, back of the envelope numbers, what the savings might be?
It was a generic presentation.
I'm just
that we
wondering how
went-
that would, if it all help with our reserve, if it might help fund our reserve account.
We had a one-time generic presentation that wasn't necessarily personalized to our
Okay.
numbers, so I think we could do a deeper dive and be able to get that
Okay.
information.
Thank you.
So,
I would hope that anything like that, hopefully this is covered of it, increases that are built in every.
Right, well, there's that too.
Keep it flat.
But then that, whatever we have decided here would then help fund the reserve account. Just thinking about driving a flat tire for another year.
anybody have anything for us?
Anything
If
else?
not, we're done.
All right, with that, a motion to adjourn.
So moved.
Second. All in favor?
Aye.
Opposed? Carried. Thank you.
Thank you.
It is 3:45 and a half. We will start the Health and Human Services Committee meeting with Department of Social Services, Commissioner Gibson.
He always gets his in first.
And he always has the best sweater.
That's
I
'cause he has
love
good
his
health.
sweater.
That's right.
It's the only.
Don't worry, I got layers on too.
All right. So these are just all, requests that have gone through point one. The first is to fill one caseworker position.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
The second is to, fill one caseworker assistant position.
Move it.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
The third is a request to fill a transportation aid position.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Number four is to fill a social welfare examiner position.
Move it.
Second.
I notice that they're staying within those that are vacating. That's a good.
Yeah, it's like people looking for promotion or,
Yeah,
you know,
yeah.
it's all due to.
All in favor?
Aye.
Opposed? Carried.
And one senior social welfare examiner.
Move it.
Do I have a second? Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
So you know, this, you can see the stats, we're already gearing up. I met with the chairman and some other folks, in the county just on, you know, getting ready for, contingencies, and all the different changes that are coming. Homeless is going to be, about what it was last year. Working with the state on my code blue budget, got a little more in my allocation, which is helpful. Because we see a lot, but you know, we may be forced to reduce a little bit of the service there. So we're still in discussions on that, but we will be. With that, I'll take any questions.
No questions? All right, thank you, sir.
Thank you.
Human Services. Oh, thank you.
Okay, the first one is simply adding some state aid for the MHA and Unity House, two of our providers. In the course of the year, they received some enhancements and additional programming, and this is a simple budget neutral state aid in, expense out.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Second one is similar, our service dollar budget. We got a couple of COLAs and they're able to spend a few more bucks again, state aid in, expense out. It's a budget neutral.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, the third one is to fill a vacant psychiatric social worker position with either a behavioral health social worker or a senior behavioral health social worker. Our psychiatric social worker retired. Her last day was Friday. We have a new person starting, actually started today. This one needed an emergency fill, which the chairman signed off on, due to the fact that it was a budgeted item that was actually traced back to 2024. We were requested them to do a resolution because it went over a year. We didn't realize it was 24, not 25, but we had to go the emergency route. The person's actually started today, so hopefully this will get through.
Dan said it's a revenue producing position.
Yes, this is a social worker who produces revenue.
Did I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
That's all I got. Thank you, guys.
Thank you, sir. Director McGann, Department of Health.
Everyone?
No.
Today, requesting authorization to fill environmental health director position due to resignation.
Move it.
Second. Further discussion? All in favor?
Aye.
Opposed?
No. Request to reappoint one of our members of the Board of Health to a 6-year term, Dr. Malamed.
Move it.
Second.
Further discussion? he's a good contributor. I enjoy being on the board with him.
Yeah.
All in favor?
Aye.
Opposed? Carried.
We'll send them your best. Request authorization to enter into a service agreement with iCentral for our early intervention program.
Move it.
Have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Requesting to increase our 2025 budget and transfer funds due to changes in administrative costs in our preschool program.
Is it budget neutral or?
So because we're reimbursed at 59.5%, we will get revenue at that rate for that 38,000 price there in the justification up there. But we do have to move some funds to cover that remaining 15,000. But we have found that another.
Okay.
I'll move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed?
It was reviewed by Jen.
Mhm.
Just about the decisions that they.
Carried.
Appreciate that.
Request authorization to contract with Access Therapy Preschool Agency.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then have I got one more, I think? Conference.
Oh, yeah. We'll have that. All right.
Sorry.
No, you're.
Not
Go ahead.
We've got a conference objective to send our community health worker to the Agricultural Worker Health Symposium
In Arizona.
in Arizona.
That's why it's coming. Oh, it's out of state. I'll
Yeah.
do that. That looked like a great conference.
It does,
Yeah.
yes. Yeah.
And she just got a.
She got
$100
she got a scholarship towards it too.
towards it. Oh, good.
And the remainder is covered by one of our public health infrastructure grants.
Stop and run.
Oh, yeah?
Arizona, yes. Brenda moved.
Brenda on the
I'll
motion,
second.
a second. Further discussion? All in favor? Aye. Opposed? Carried.
And then my director's report, and I'm happy to answer any questions about that.
Just an update for starters on vaccinations, COVID.
So we've been doing flu, lots of flu. COVID, we got our standing orders signed on Friday, so we haven't administered any yet. We did have to order Moderna for 6 months to 5-year-olds. 6 months, and then 5 to 11, we had to order more Pfizer. So the Pfizer is fully returnable. So whatever we don't use, we can just send back. So we ordered that without hesitation. The Moderna is not returnable. So I think we ordered 2 boxes, so 20 doses.
Well, do you think you'd be able to get more if you need it?
Yeah, I think so.
Okay, so it's better safe than sorry.
That's what we figure.
You still have to refrigerate Pfizer?
Not the same way. You do have to refrigerate it, but not the deep freeze like,
Okay.
Those early days.
Is this the same formulation as a year ago? Or they developed, yeah.
I think they made a couple changes, but it's very similar. They're still looking at the Omicron,
Variant.
subvariants or,
They just made a cherry flavor this year. I shouldn't. Yes.
You had to.
It's disappointing that they don't keep that contemporary or they could.
So early intervention, I see we have almost 20 kids on the wait list. What would it take to clear that back up?
So what holds us up most is lack of providers. And that's really a system-wide deficit. So apart from, advocating at state levels, and recruiting people to rural health the way that we are for so many things, right? Yeah, it's tricky.
But it's a gamble whenever they do a house call. right? Because
Yeah,
they don't
yeah.
get compensated if there's a cancellation
Correct.
last minute.
Correct. We have, they operate as like independent contractors with us, you know, they don't have somebody doing their billing for them. They don't have somebody setting their appointments for them. It's all like one person. So in the rollout of the EI Hub, which I know you've heard me say more times than anybody probably wants, has put a burden on our already overburdened system. We lost one provider, but we did get them back. So, you know, it's better than we thought. We thought a lot of people were gonna say, forget it. You know, they haven't said that yet. I think a lot of them are moving just to preschool, because there's not that same
risk.
yeah, that's a good word for it. Risk.
Is there any way to reduce the admin burden through our staff that would make it easier for them to see in the field?
Not really.
Okay.
The volume that we're talking is not something that we can take on. We're involved in service coordination, but any more than that, it's just not really something that we're equipped to do.
And there's no other not-for-profit or I'm trying to think, any other group or organization that could maybe perhaps facilitate the admin side, you know?
That I'm aware of, no, that's not to say that there isn't. I will say that I don't know how other states do it. There's gotta be a better way. I think that's very helpful, but
Yeah.
If I could just, I'm on your board. It's even beyond this as a problem. You know, I don't think people are aware that we don't have the therapeutics that we need. We're desperately lacking in resources here. We often have to take them as far as Albany and Latham, and that's if we can get them appointments. So, this is a forever kind of problem. And this is just one piece of that. So it's a very difficult thing. And again, that's where rural health is supposed to help us out. But even that doesn't attract the providers that we need.
So it's a systemic.
yeah.
Okay.
It's the youth. It's too easy to make money with TikTok. Go out and engage in a worthy profession. But I digress. Any further questions for Director McGann? All right, thank you very much.
Thank you so much.
Although I did see we had a death attributed to Lyme's
I
disease.
saw that.
So that wasn't this month, but it was this year, yeah. You know,
It's funny, I only picked that up this month too.
Well, thank you very much. Last but not least, Office of the Aging, Director Benvenuto.
I'm glad to know it's not as cold as I thought it was gonna be in here, but I do think that's fun. I was expecting.
I turned it on.
I appreciate it, but then I turned it back off.
Yeah, I had to take my phone and take the chill.
So the only resolution I have for you today is a request to renew contracts with various providers. We've got some of our respite provider agency, congregate meal sites, legal services, institution, et cetera, dietitian.
Do I have a motion?
Question, is any of them new?
Legal Aid Society will be new.
Okay.
Town of Stuyvesant will be new.
I was gonna ask you, you're gonna do that January 1?
Yeah.
Okay.
What's $45,000 with legal aid services? What is that all about?
So Legal Aid Society, right now we have, Family Advocates LLC is the contractor that we have now. That provider has been talking about wanting to retire for a while. And so I did some research over the last year, and Legal Aid Society, which is based out of Albany, they work with 4 other AAAs
if I remember correctly, Albany County, Fulton, Montgomery, and Schoharie, I believe, around here. And then they also, their northern office, I can't remember where that one's located, works with a lot of the AAAs up in the northern part of the state. So I called around to some of those counties and asked, what does that service look like? What do you get out of it? Quite honestly, it seems like we're gonna actually get a little more bang for our buck, because they are able to, there's a name for it, Legal Services Corps, maybe is what it's called, but they are part of a network.
What we were paying?
This is exactly the same, yeah.
It's a different name.
Actually, this went up slightly, but we worked on raising the contract last year, so it's not increasing for them specifically.
So this is replacing Rosemary.
Rosalie,
Rosalie.
yes.
So I have a motion.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then I have my quarterly report for you. There's some numbers on there. We went through 1,500 of the farmers market coupons. Which to be quite honest, when we got that amount at the beginning of the season, because usually we only get about 700, 800, and we'll maybe ask for about 100 more. I wasn't certain if we would be able to do it, but we got every single one of those coupon booklets out, which was exciting.
And you doing your survey? It ended the other day too.
It ended,
You know
I
that,
believe
yeah,
it was
there.
Friday.
Yeah.
I talked to Joyce Thompson, who's the chair of our, vice chair of our advisory council today. We've been inputting the, paper copies. I put in a bunch last week. They were working on some over the weekend. There'll be some more this week. I don't have a number of the amount of the digital ones that we got yet, but I'm hoping to get details maybe at the end of this week, so.
Okay.
We shall see. I know we got a lot of surveys in.
Good.
There were a lot that came through my
We
office.
kept
And that
trying
was
to promote it in town, but it was hard to do those things.
Yeah, I had one hard copy, which I think our liaison picked up today.
But I mean, we could feel it. We could feel coming in from across, it wasn't just our usuals that were doing it. So I very much appreciate that. There's an AARP driver safety course, and I figured I could leave this for the front, if you would like. Coming up, I would never. October 27th, it'll be at our office, the second floor conference room. I put the pricing on that sheet. I believe it's 25.
25 for AARP members and 30 for non-members. And it's from 8:30 to 4:30.
$200 in my car insurance.
Yeah,
I could do that.
Yeah.
It saves some people. They don't tell you everybody.
Well, there's a driving record to be considered.
Medicare open enrollment, October 15th that's tomorrow. It's gonna be busy at my office, man. And 8 new HDM clients, 3 new menu items for October. We're trying ambrosia with Greek yogurt instead of sour cream. We'll see how that goes. I personally love ambrosia, so I don't really want them to change it, but cheese ravioli with meat sauce, broccoli and cheddar soup. I took a break on town board presentations with all of the senior day fun and less than fun planning activities, so I'll be jumping back into that. And if I remember correctly, Germantown and Canaan we talked about in the fall at some point.
We were gonna do October, but October got away from me, and so I didn't.
That's okay.
You should do something Stuyvesant early when you move to your congregate site over there,
Yeah.
January or something. And explain to everybody what's going on. So you get a few people, maybe.
Yeah.
New.
So I'm scheduled for Livingston in November. I don't know the date off the top of my head. I want to say maybe the 14th. It's a Thursday. I think they usually do
Second
it.
Thursday of the month.
It's Germantown,
Germantown is second Tuesday.
second Tuesday. And yeah, that's kind of all I really got for you today. I can think of anyone.
That's good enough.
And the survey results will be tabulated and presented.
As soon as I get them, I will present them. Would that be something that you would like me to present at the full board or present
I think
here?
it'd be a good idea, right?
Depends on your turnout, what you got,
Okay. I'll keep you posted.
You got the college folks working on that for you, do you? Yeah.
Won't step in. We've got to do, I know there's still like at least 200 of the paper copies that have to be input. So we've been dividing and conquering that.
So maybe November committee and December full board, something like that.
Oh, yeah, that's right.
Sounds good to
I
me.
was gonna say there's no December full board, but yes, there is. We have November meetings.
All right, any further questions for Director Benvenuto?
Thank you.
Thank you very much.
Thank you.
Anything else from the committee? Would the public like to weigh in today? There being none, I'm gonna ask for a motion to adjourn.
I'll make a motion to adjourn. I'll second.
All in favor?
Aye.
Opposed? All right, thank you, everybody.
You.
Okay, I'd like to call the October Public Safety Committee meeting to order, please. First one up is emergency management.
This will be short and sweet. I was hoping to give you an update on the hazard mitigation plan. The last report we had from New York State was there were 7 municipalities that had sent their adoption resolutions. Since then, I know there's probably a half dozen more that have, including the county, which I sent up our resolution last week. Haven't heard anything back, and I'm assuming that because of the government shutdown, that there's going to be a delay, because this probably isn't considered an emergency action. So I feel we're going to hear about, it's going to be updated, but I'm just not sure exactly when. But we're still asking. I thank everybody that's done it already, all the work that everybody's done, municipalities that have gone through the adoption process, and those who haven't been able to do it yet, we encourage them to do it. This is the last part of it, and the sooner we get everybody in, the quicker we're eligible for different types of grants, depending on what's going to happen. So that's it.
Thank you.
Thanks.
Public Defender.
Good evening, everyone.
How are you, sir?
Well, thank you. Just had one general resolution request. Seeking authorization for the chairman of the board to consent to a 1-year extension of the Board of Council first arraignment or appearance ending, which ends in December 31st.
All in favor?
Aye.
Opposed? Okay.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you.
Sheriff. Under Sheriff, how are you?
I'm well, thanks. How are you?
We are well, thank you.
All right. We have, the first. It's to fill it's a vacant keyboard specialist position, but we don't have candidates, so we want to reclassify it from a keyboard specialist position, which is a grade 11 to a grade 10A clerk typist position. And then we'll accept the lateral if we have somebody who wants to come over. And so that, I think that's, all right, hold on, that's this one, sorry. All right, order. Oh, sorry. Yeah, no, you're good. So there's a separate one too, yeah. Yeah. So this is the keyboard specialist one, right?
This isn't moving it though. This is actually to fill the position.
Yep, so it's to reclassify it from a grade 11 to a 10A and then fill it.
I don't see the reclassification on this one.
It
There
says
was
it
one
on,
meeting.
it's on here.
All
I
right,
see
so
it.
there's, all right, so let me do
There
that
was
one
a-
first, because there's
okay.
another one. We have
Okay,
two openings and
I
then
just want to
one
be clear on what we're.
All right, so
All right,
we can
hold
go
on,
back to
let me
that first one, I'm
catch up to you.
sorry.
Yeah, there's only one of them.
Yeah, it's on
All right,
the,
that's
There
it,
we go.
that's the
All right,
reclassification.
I'll second it. I think so.
all in favor? Opposed? So carried.
And then the other is a keyboard specialist position where a retirement. So we want to keep that one in the.
And this is different from the.
Different
position
from
you
the
just
other, yeah.
finished. I'll move it.
Mhm.
Second? All in favor?
Aye.
Opposed? So carried.
And a part-time clerk position, no? No, part-time clerk position, she left and went to another agency, so. So request to fill that one. Move it.
Second. All in favor?
Aye.
Opposed? So carried.
And then the last is to award the bid to Island Tech to upfit the vehicles. Marissa did all of the legwork for us in getting the lowest bid in contract. So it's just to award the contract to them official.
Second. All in favor?
Aye.
Opposed? So carried.
Is it?
Well, thank you. Any
Thank
questions?
you.
Thank you. Fire coordinator.
Try to be shorter than you all. I got nothing but the monthly report, unless there's some questions. Perfect, I did it.
I have a quick question.
No.
Yeah.
Nothing about your report, but I know the LDPA in New Lebanon, took on the echo level response. Did
Yep.
most, fire companies throughout the county take on that?
That's the only one that's come on board
Okay,
recently. There's some others that have been talking about it, but they haven't come on board yet.
okay.
Anything from the committee? Anything from the public? I'll entertain a motion to adjourn.
Second.
All in favor?
Aye.
Opposed? So carried. Thank you, everyone.